Hey everyone, welcome to another episode of What the Dementia by Bambu Care. I'm your host, Brianna Wilson. I'm a certified dementia practitioner and the founder of Bambu Care. So today we will be doing a Q&A where I answer 3 questions from our listeners. If you aren't familiar with our Q&As on What the Dementia, they are super informal and I'm just answering your questions, okay? I will be doing more Q&As in the Bamboo Treehouse Resource Library, where I'll dive in deeper into specific questions that you all may have. So if you haven't joined the waitlist for the Bamboo Treehouse, then I'll put the link in the podcast notes. If you have no idea what I'm talking about, Bamboo Treehouse is essentially this ultimate dementia care resource hub. So everything will be in one centralized place and easy to navigate. Also, as a member, you'll get free access to our webinars and replays, regardless of if they are paid or not, and the replays do not have a time limit, so that's good. You'll also get special discounts on our products, events, and services, so it's really going to be great. So if you're even the least bit interested, I definitely recommend signing up for the waitlist so that you will have access to a special discount and even lifetime offer opportunity when we launch, okay? So let's go ahead and get into today's questions. So the first question is, how do you get someone with dementia to accept their diagnosis? And the answer to this is probably something you don't want to hear, but the short answer is you can't. There will be some people with dementia who come to accept their diagnosis on their own because they are very aware of their deficits, but others will have what we call anosognosia, which is just a fancy word for a lack of insight into their deficits. So to them, nothing is wrong. They still believe that they can do things that they really can't do, or they may not find anything wrong with the way that they think. And we see this with some people with dementia, some people who've had a stroke, and some people who deal with serious mental illnesses like schizophrenia. So it's a thing, and it's very different than denial. Denial would be knowing something is wrong, being very aware of your deficits, but not wanting to admit or contribute the wrongness to dementia. That would be an example of denial, okay? And yes, there are some people with dementia who are in denial, but many do have anosognosia, and it's very hard to try to piece apart. So honestly, it's not even worth the energy to figure out, in my opinion, because it just is what it is, okay? Now, I know this question usually comes up because people want to know, well, how do I get them to accept help if they won't acknowledge that they need the help? Which is a great question. And the answer is that you need to find ways to help them without making it about them, or by giving them the help they need in small, unnoticeable, or unobtrusive ways. So depending on the scenario, it could be about someone coming into the home to help you out around the house because you need help, even if that's not the case. It could be about doing someone a favor because maybe they're really in need of a job or overtime hours. That doesn't have to necessarily be true, okay? Maybe the favor is for you because you can't do it alone. Now, for this approach, the whole favors thing, you have to be careful because personality plays a large role in whether or not this would be a good approach, okay? Some people just don't really care too much about doing favors for people because they figure, hey, that's their problem, not mine, right? So that's just important to keep in mind. Also, depending on the scenario, you could try slowly adding or removing things from the environment, okay? But this is what I will say. Pointing out the person's issues as a way to get them to accept help or reminding them of what the doctor said will likely do you no good if a person has made it very clear that nothing is wrong with them. And honestly, it will only create more resistance, as you may be finding out. So you really have to get creative to find ways around it, okay? The second question is, how do you get someone to go to the doctor when they refuse to go to the doctor? And I love this question, not because I have the best answer for it per se, but because I am that person. I am the person who refuses to go to the doctor. I have little issues here and there that my mom always tells me that I need to go get checked out. And I'm always like, nah, I'll pass. I'll just deal with it on my own. Though I do work in the healthcare field, I'm honestly not the biggest fan of the healthcare system, and I have my own biases, and I try not to put those biases on others, right? But in general, I've had bad personal experiences and have largely found it to be a waste of time, so for me, I'd rather not go. But there are a few things that I will go to the doctor for, and that's usually if I'm feeling really, really bad, especially if it involves my brain or head or something like that, or a unmanageable pain, or I'll opt for like an urgent care or take a telehealth visit with a random doctor if I just need an antibiotic or something like that. So don't be like me, okay? But with that being said, if you find out why your partner doesn't want to go to the doctor, that can be very helpful. Some people think it's a waste of time. Maybe they don't like the wait. Maybe they have to walk too far and it's tiring or inconvenient. Some see doctors as just wanting money. Some people have had bad experiences with needles, machines, unprofessional people, doctors not taking them seriously, whatever the case may be. So it's important to know why they don't want to go to the doctor because that will inform your approach, okay? Also, nobody likes their problems laid out on the table. Like you have this, and this wrong with you, and you need to go get checked out because if you don't, blah, blah, blah. Most people don't want to hear that, okay? Plus, it puts them on the defensive and makes them more likely to push back and say, no, I'm fine. Nothing is wrong with me. You don't know what you're talking about. The doctor doesn't know what they're talking about. I don't need to go, right? So my first recommendation is to see what you can do from home first. For example, if you suspect a UTI, try an at-home UTI kit first that you can just pick up from your local drugstore. If their provider offers telehealth, maybe that could be an option, right? Now, if none of that's an option or relevant, then here's my recommendation. Change your approach. Make the appointment seem like not a big deal, but something that just needs to get done and out of the way, okay? If giving a big heads up gives them time to say no and change their mind, don't do that. In some cases, you may have to literally tell them the day of a few hours before. Like, I am so sorry. I thought I told you, but we have a doctor's appointment today at 11 a.m., but it should be quick and we can go get ice cream after or something, right? Which leads me into my next suggestion. So another trick is that you can try bundling the doctor's appointment with something more desirable when you're delivering the news about this appointment. So doctor's appointment and then ice cream or out to eat. Doctor's appointment and then go visit someone like a friend or family, grandchildren, whoever. Doctor's appointment and then go shopping. Whatever the person would actually prefer to do. Something they wouldn't mind getting out of the house for. So de-emphasize the appointment because that's just a technicality, right? And play up the more enjoyable activity, okay? Now, if all else fails, ask yourself, how important is this doctor's appointment? Some appointments will definitely be important, and others are more of a nicety, like, well, it would be nice, but when we take a look at the big picture, it doesn't really make that big of a difference, okay? So just keep that in mind, okay? Then the last question is, it's been a week since my mom has showered. She doesn't listen when I tell her to take a bath. How can I convince her to shower? So showering is probably one of the biggest challenges caregivers face. And because of this, we will actually be doing a whole webinar on this topic. And I want to say June-ish. But as soon as I know, I will definitely let you all know because of course I still have to put it all together. And you know I like to make it interactive, so it takes time, right? Now I wish there was a simple answer to this question, but honestly there's not because there are so many things that we have to take into consideration. which is why I want to do a whole webinar on this topic. But for the sake of today's podcast, let's briefly talk about two of the biggest considerations, okay? The first consideration is the why behind why they don't want to shower. And the second biggest consideration is going to be your approach, which has so many layers to it. So let's start with the why. There are so many reasons why someone living with dementia wouldn't want to take a shower. But here are 12 reasons, okay? So 1, the environment is too cold. Bathrooms are so cold for no reason. And after you shower, it's even colder, okay? 2, the sensation of the water may be uncomfortable or painful. For many people, it can start feeling like pins and needles, which is one of the reasons handheld shower heads are very helpful because it gives you more control. There's different settings. You can kind of adjust it to your needs. 3, the sound of the water could be scary. Have you ever noticed how loud the shower is? It is so loud, okay? 4, the water could appear to be invisible, which can also be scary to hear or feel something, but not be able to see it, right? And then 5, they may be afraid to fall, whether that's getting in the shower, out of the shower, whatever the case may be. 6, showering could be painful, exhausting, or difficult to do because of maybe sequencing difficulties. 7, they may feel uncomfortable being in the nude and not want to share their goodies with onlookers, right? 8, they may prefer to take baths over showers. 9, it may not be a time of day that they would normally take a shower. So for them, it just doesn't make much sense to shower at the time that you're requesting them to shower, right? 10, the environment could be or feel unfamiliar and therefore make them anxious and uncomfortable. 11, they may be experiencing feelings of loss of control. Or 12, they may just not want to shower at the time you requested or believe they've already showered. And I know for me, there are plenty of times where I just do not feel like showering, okay? And so any of these reasons could be reasons why your partner doesn't want to shower, and there's plenty more. But if we had to sum it up, fear, discomfort, preference, need for control, and memory loss, right? Now, the reason why they don't want to shower will impact how we approach the situation. So just to give you some quick examples, do we need to make modifications to the environment to make them more comfortable and to help them feel safe? This could be through adaptive equipment like a shower chair or a tub transfer bench, grab bars, a small space heater, warming up the towels, letting the water heat up and letting them test it first, respecting their need for modesty and covering them up for their shower, things like that. Do we need to address any pain issues first? If it's a preference and need for control type of thing, giving them options like, do you want to take a bath or a shower? Maybe they'd prefer a sponge bath, and so that may be a necessary switch up that you have to be willing to accommodate. Or it could be something like, hey, I've set your shower up for you. Did you want to shower before lunch or after lunch? If it's exhaustion, setting up the environment appropriately, making things easy to reach, taking out things that they don't need, guiding them through energy conservation strategies like sitting to shower, using long-handled sponges so that they don't have to bend, not having the water too hot, focusing on the hot spots first, so if you're too tired to continue, you can confidently get out knowing that you're about as clean as you need to be, having a chair available outside of the shower, turning the vent on, keeping the door open, making sure that the clothes are already picked out and ready to go, things like that. Like I said, there's so much that can go into making showers more desirable. Now, I will say that occupational therapist, which is what I am, I don't often broadcast that, but that's what I am, Occupational therapists are great at assessing what could make the bathroom and shower environment safer and more accessible, as well as recommending strategies to help facilitate greater independence and participation when it comes to bathing or showering. So if this is all a challenge, definitely ask your partner's doctor for a referral to occupational therapy services so that they can come into your home, do an assessment, and make recommendations or provide training as appropriate, okay? Then we have your approach. Telling your partner they smell, pointing out that they haven't showered in days, threatening them, telling them they're going to get an infection if they don't shower, tricking them into shower and then essentially force bathing them as they scream and yell. None of these are good ideas, okay? Like I've said many times before, relationship building is a large part of dementia care. And when you do things like this or say things like this to taint the relationship, you only make your job harder because over time they will often become more resistant. So before you do or say anything, reverse roles real quick in your head and ask yourself, how would I respond if someone approached me like this? If your answer is pissed off and offensive, then that may not be the way to go, okay? So what's a better option? Well, providing them with options can go a long way. This option or that option. Pairing the task of showering with something more motivating or desirable like a spa treatment, getting ready for church or an outing, trying a new scented soap if that's something that they're into, trying on new clothes or old but forgotten clothes, whatever is appealing. And again, de-emphasize the shower and emphasize the motivation, the more appealing thing, okay? Now, for some people, you may have to leave out the word shower or bath altogether and just give them a reason to come into the bathroom with you or go into the bathroom on their own or initiate taking a shower on their own. For others, you can use bath or shower, but you have to make sure that you choose the right word. I've asked patients, do you have any difficulty bathing? And many will say, I don't take baths, I take showers. So the language you use is important, and it could be one of the reasons why your partner is refusing to shower or take a bath, okay? You also have to learn to be okay with refusals. Be okay with showering looking different than you would like it to be. Maybe sponge baths are the go-to now. Maybe showers are only one time a week. Maybe you can only get one body part bathed a day. If you help with toiling, maybe this is a time you add a little soap and water to the process. If you help them put their deodorant on, maybe this is a time you wipe their pits with soap and water first. If you help them with their socks and shoes, maybe this is a time that you say, oh, you got a little something on your feet. Let me help you get that off. And then you wash and dry their feet real quick before you put their socks and shoes on. You gotta get creative sometimes, okay? But like I said, there's a lot that can go into showering, and I want to talk more about it in a more detailed and organized way, okay? So definitely be sure to be on the listen for when I announce the shower webinar, because you do not want to miss it, okay? So those are all the questions for this episode. Hopefully you found my answers helpful in some shape or form. If you have any questions of your own, feel free to email us at podcast@whatthedementia.com. If you did enjoy this podcast episode, or you just enjoy the What the Dementia podcast in general, please consider leaving us a good review so that others like yourself can find our podcast, okay? So thank you for joining us on another episode of What the Dementia by Bambu Care. We look forward to catching you on the next episode. Take care, and until next time, stay strong, care on, and remember, you are not alone. Bambu Care is always here.